to the Idea Exchange podcast. In today's episode, we will be talking more about malaria. I'm your host, OSP, and our guest is.
Yamigan.
Welcome.
Thank you.
What is malaria?
Okay, so when you talk of malaria, it's just a febrile disease which is associated with fever and fever, malaise, and rigors, basically.
Alright. What are the epidemiology of malaria?
Okay, so when you talk of epidemiology of malaria, it's common in sub-Saharan Africa. When you talk of sub-Saharan Africa, we mean the tropical Africa. Around Malawi is within the tropics. When you remember your geography, you understand what I'm saying. Tropics is whereby from around we have an equator. Then when you move from equator, we move around. We have tropics whereby sometimes our weather is not really hot. It's a little bit cold one, which favors the breeding and development of these malaria parasites and especially mosquitoes. Yeah, so it's common there. But when you talk of in individuals now, commonly affect the children. Yeah, children, pregnant women, people who lost, people who don't have spleen. Maybe they lost their spleen. Maybe they had cancer and the spleen was removed. Sometimes when you are, I have explained a lot about the pregnancy thing, right?
Yeah.
And people who have recent travels, common in these groups of people. Maybe you have traveled somewhere, especially someone from abroad, from UK, has come to Malawi. They are at risk of developing anemia.
Alright.
But it can attack everyone. You should know that. All right.
Yeah.
Yeah.
What are the causes of anemia?
So basically, anemia has so many causes.
Yeah.
Basically, it is caused by plasmodium. But plasmodium is in so many species. But in our setting, when you talk of Malawi or in sub-Saharan Africa, the most common plasmodium which causes malaria in our setting is Plasmodium falciparum. Yeah, so basically that's the causes. But there are so many causes. The other ones we have Plasmodium ovale, Plasmodium vivax. Those are also other causes of malaria, but not common in Malawi.
What are the risk factors?
Maybe before you go to the risk factors, I just need to add on how this plasmodium is transmitted.
Alright.
Yeah. This plasmodium is transmitted through female anopheles mosquito. So mosquito is not just one thing. It is also, there are so many species of mosquitoes. Yeah, so we have anopheles mosquito, which is common in sub-Saharan Africa. And it's that type, especially the female one, which transmit this plasmodium from one person to another. So basically, what does it do? Mosquito has bitten you, okay?
Yeah.
And it has carried the I should call the sporozoite. I'll be using. I didn't want to use this word. I'm trying to find a better way to call it. Yeah, but it has carried, let's say, a childhood form of malaria. Not malaria, a childhood form of this plasmodium thing, and it has carried from your blood. It can when the same mosquito bites me, it will give me. So that's how it is transmitted.
All right. What are the risk factors of malaria?
Okay, so basically malaria can affect anyone, despite the age,
Yeah.
despite the race, despite where you are coming from, whether you are a male or a female. It can affect anyone. But there are specific groups of people who are at risk of developing this malaria thing. One of them are children. Okay,
Oh.
maybe I shouldn't say children as such, but extremes of age. When I say extremes of age, I mean children and very aged people, because of immunity. Their immunity is not that mature enough to fight the plasmodium once it has been introduced into their bodies. So they are at risk. And the other people are pregnant women again. Okay?
Oh.
So pregnant women, they are at risk, especially those who are pregnant for the first time. They are at a very great risk of developing, of suffering from malaria. Yeah. The other group of people are the people, like I said, those who have lost their spleen.
Yeah.
Their spleen is responsible for development of white blood cells. Um, you know that in our bodies we have different blood cells, right? We have red blood cells, we have white blood cells, platelets. Those are cells in our bodies, in our blood. But the spleen itself is responsible for the production of white blood cells. So white blood cells are the ones which protect us from different infections. So if a spleen is not there, it means a person is not able to produce white blood cells.
Yeah.
So if you don't have white blood cells, it means any infection can easily come in. But where the problem, absence of the spleen. The other people who are at risk are the people who are travelers. When I say travelers, I don't mean you from Mankochi and then you go to Mulanje and then you say I'm a traveler. No. And or you have traveled from where from?
Mount Pleasant.
Okay, so she's from you are from Mount Pleasant and then you have traveled to Karonga and then you are saying you are calling yourself a traveler. No, I mean those people who are coming from maybe from UK.
Yeah.
Yeah, because in UK they don't really have malaria there. But then those people maybe they come to Malawi or any country in sub-Saharan Africa.
Uh,
They they have not been exposed to what? To mosquito. They haven't been. There is no mosquito there. Mosquito is here. So when they come here and they are bit by mosquito, in their body they don't have. I should say, I can use a. I don't want to use a medical language, but they don't have antibodies already preformed, because in your body you have antibodies because you have been bitten by mosquitoes so many times and you have been suffering from malaria. So in your body there are already antibodies which when mosquito or when plasmodium has been introduced, right away it is being fought back. But those people, they don't have antibodies, and when they come here they easily catch malaria. So travelers are at risk of developing malaria, of suffering from malaria. Sure. Maybe before you go on, I can just add people who have naturally protected from malaria are those people who have sickle cell disease, because plasmodium does not find enough place to sit. because their blood or their hemoglobin is sickle shaped. So it doesn't really find enough space for it to multiply. So yeah, these people are a little bit protected.
Alright. What are the development of malaria?
Okay, so I'll just explain as simple as possible. Development is like you're talking about the life cycle of the plasmodium itself. So once, like I explained, once female anopheles mosquito has bitten you, from you it gets what we call sporozoites. Sporozoite is like larva of this plasmodium. So it gets larva from you. I forgot the word larva that time. So it's larva of mosquito. So it gets it from, not of mosquito, but sporozoite of plasmodium. So it gets it from you. And when it gets it from you and it also bites me, it gives me that sporozoite. So where does it go now? It passes through blood to your liver. And not to your liver, but to your lungs. Okay? Sometimes, of course, it goes to your liver. Mostly it goes to your liver. And when it goes there, it multiplies. When it multiplies, it gets back. So it means so many sporozoites multiply. And when they multiply, they become what we call merozoites. So first of all, you get sporozoite from one person, it gets to your liver, they multiply, they become merozoites. These merozoites, when there are so many, they go into your red blood cells. When they go there, they also start multiplying. Inside what? Your red blood cells. Okay? So when they multiply, they become many. So when they say, I have this, I have maybe your phone is a red blood cell, and then you are putting so many batteries, they are just coming. Your phone can easily burst. Okay, so that's what happened to the red blood cells. They burst. So when they burst, they release a lot of merozoites into your blood system, and there are these merozoites, and their chemicals they produce, which are responsible for the development of those signs and symptoms of malaria. So basically, in simple terms, that's what I can say. So you get uh, from one person, it gets into your body, goes to the lungs, multiply, uh, released into your bloodstream, they multiply in your red blood cells. When they multiply, the red blood cells burst. The chemicals from the bursting of the red blood cells, they are the ones that initiate the signs and the symptoms. Sure.
Alright. What are the signs and symptoms of malaria?
Okay. Even if I ask a child from the community for you to say, I'm suffering from malaria, they can tell you,
Yeah.
isn't it?
Yes.
Yes. So for the signs and symptoms of malaria to develop, they take about 7 to 30 days after you have been bit by mosquito which has carried plasmodium.
No.
So it has, we call it incubation period, 7 to 30 days. So if you are suffering from malaria today, you should know that I think I have been bitten by mosquito within these 30 days. Yeah. So a person, sometimes they may show the following symptoms, like fever. Okay, fever, malaise. Okay, so when you say malaise, it's when you are feeling like you feel like you are feeling hot, but at times you feel cold.
Alright.
Yeah. So you see some people who are like people who suffer from. I hope you have suffered from malaria sometime.
Yeah.
Uh, you had the sun besting yourself. Okay, you feel like you're feeling cold. Yeah. But when we measure your temperature, we find that your temperature is very high. So it's that condition. Sometimes you feel headache. Headache. You see people say, mafana kuna mtu kundipweteka, ndikumva kuzizira.
Yeah.
Things like those. Sometimes you feel like you have flu-like symptoms. Feeling like I have flu. It's not really flu, but you have what? Anemia. Sometimes you feel nausea. Okay, you feel like seru, kind of. Sometimes you vomiting. Sometimes you have diarrhea,
Yeah.
abdominal pain. Those are some of the signs and symptoms of. And sometimes you feel dizziness. Okay, you as if things are moving about. You can't see properly, and sometimes you are weak. People who suffer from malaria, they are weak, and sometimes you feel you feel paleness. Paleness, if like looking into your eyes instead of this conjunctiva being pink, you find it is pale, white is like. Sometimes there is confusion. Okay, some people they're talking to themselves. They feel like they have developed madness. Okay, just a cute thing. They're talking to themselves. You think maybe they are mad, but it's malaria. Sometimes people lose consciousness. Losing consciousness is like they faint. Sometimes people faint. Sometimes they develop seizures. But yeah, those are some of the uh, signs and symptoms of malaria.
Alright. How do you investigate malaria?
Okay, so investigation, there are so many investigations, but commonly in our setting, we do what we call malaria blood test. Okay,
Yeah.
so we just, I hope you have been tested for malaria sometime. That's a rapid malaria blood test. We call it MRDT. Okay, so you just take some samples, they prick your finger, they take sample, they put on that sheet, they see whether you have malaria or not. The other way is blood culture, okay, and the microscope. So sometimes they take blood sample in a bottle. They go to the lab, they check. Let's say that MRDT thing is not showing malaria or is negative, but the person is showing features of malaria. You take a sample of blood, you go to the lab, you see through under microscope. Sometimes you can find plasmodium moving around there. So you say that the person has malaria. Basically, in simple terms, those are some of the uh, investigative ways.
Alright. How do you classify malaria?
Okay, so classification of malaria can be simple malaria, which is more common, or severe or complicated malaria. Yeah, so simple malaria, they are the ones people, so we are just showing weakness, headache, flu-like symptoms, fever, okay, sometimes nausea and vomiting, okay. But severe malaria is whereby a person is now having prolonged vomiting. They're just vomiting maybe for a long time, and sometimes they have severe diarrhea which is not stopping. Sometimes they have abdominal pain. Malaria of abdominal pain is one of the severe thing, because for you to develop abdominal pain, it means even the liver has been really affected. Sometimes severe malaria is the one which comes with swelling of your liver or even of your spleen. Sometimes you become jaundice. When you say jaundice, it's yellowing of the white of your eye. Have you seen someone like that? So you see the white of the eye. The mine is white, right? Sometimes it becomes yellow. That's jaundice.
Right.
Yeah. Sometimes jaundice can be seen in the palms.
Uh,
Palms are usually pink color. I don't know, but sometimes it becomes yellow. That's jaundice. It's a feature of severe malaria,
Malaria.
and also some a malaria which is coming with confusion, loss of consciousness, seizures, or coma. It's a severe form of malaria.
Right. What are the treatments of malaria?
So treatment for malaria is basically depending on how the patient has presented. Um, you treat them according to the way they have come. Sometimes when a patient is coming with a simple malaria,
Yeah.
you just give them la, they go. Okay?
Yeah.
La and Panado, they go. But if they're coming with severe malaria, we treat them different. Like we give them drugs which we call artesunate. Artesunate has displaced the quinine. I know sometimes maybe people who have severe malaria were given what? Quinine, right?
Yeah.
This time around the quinine was phased out. We give them artesunate.
Right.
But once they finish their artesunate medication, we start them on last year. Yeah.
All right. What are the prevention of malaria?
Okay. I think you are asking about some of the ways we can do to prevent malaria, right?
Yeah.
Okay. I hope in primary school we learned this and we were writing this on exams. Like some of the ways we could say you should be you should sleep under mosquito nets. I know in the radio they even advocate this. Sleep under mosquito nets throughout throughout the night, throughout the year, entire night. So that's one way. The other way is to wear the protective clothing, especially during the night. When you're chatting outside there, make sure you put on something long so that you can avoid mosquito bites. The other way is mosquito repellent. Medical students are one of the groups of people who use mosquito repellent so much. Maybe I shouldn't say medical students only, but university students because mostly we study at night. So we use mosquito repellent uh, to get away of these mosquitoes. Sometimes we need to reduce the breeding sites. So some of the breeding sites can be bush areas. So it's just a bush which is not functioning properly. Okay, if there's bush around your house, you can find that mosquitoes breeding through those bush areas. Sometimes you need to eliminate pools of water. For example, dams which are not functional. You don't know why we have a dam here. It's just a breeding area for mosquitoes, so you need to drain those dams or some stagnant water. Yeah, and sometimes you need to spray your homes. I hope you know the doom. Yeah,
Yeah.
so that's one way of spraying. And the other way you can prevent malaria is malaria prophylaxis. When you say prophylaxis, we mean you pre-give medication to people to prevent them from catching plasmodium. For example, those people who travel from outside, they are given medications so that when they are during their stay here, they shouldn't catch what malaria. That's one way. So yeah, basically those are some of the, and even I said this pregnant women are also at risk of developing malaria, right?
Yeah.
Yeah, so you need also to give they give them fancida during pregnancy to prevent them from developing severe malaria, which can affect the child. Yeah, so those are some of the ways.
Is there anything you want to add that I haven't asked?
Sure. Maybe I can just add that our country, like the Malawi government, through our partners from outside,
Yeah.
especially USAID, there's malaria project undergoing in the country. They have tried their ways
Yeah.
to reduce this impact of malaria in our country. Some of the ways is through awareness. I hope you have been hearing messages like advertisements through the radios, through internet, advocating people to avoid malaria through so many ways. And the other way, apart from awareness, is distribution of mosquito nets. Okay, maybe you have been receiving mosquito nets, or you have been seeing people receiving 6 mosquito nets in a family of 2 people
Yeah.
happening in the communities. And how do people use those mosquito nets? They make farms, gardens, and some people use this for what? For fishing. It's sad, yeah? But those mosquitoes are not meant for those. It's for sleeping. You see someone is sleeping just outside, not even in the mosquito nets, but they are using the net for their farms or for their gardens. It's very, very sad. So that's also what I can say to the Malawians. Those nets are for us. Because
Yeah.
malaria is not a simple disease as people think. When you come to the wards, people are there suffering from severe malaria, and people die,
Yeah.
especially children. They die from malaria. So, how can we prevent malaria? Is to make sure that these children are free from mosquito bites. That's one way.
All right.
Basically, that's what I can add.
All right. Thanks for your time.
Thank you so much.